I joined the faculty at UCSF in 1997 to found the Division of Geriatrics. Our dream at the beginning was to create the best academic geriatrics program in the world, one that would really advance our ability to care for older people. So over the last 20 years, the division has grown phenomenally, really in the scope of its vision and mission.
Before, we were really tiny, and now we are in the top 5 best divisions of geriatrics in the United States, which I think is something really to be proud of. Back in 1997, we had 2 faculty. We were primarily at the San Francisco VA. And then over the past 20 years, we've grown. We're going to be up to 41 faculty. We have 5 fellows this year, and we are across all the major campuses of the University of California of San Francisco. We have a really talented group who are passionate about improving the care of older people.
It is a place for people who are like-minded, who are devoted to and passionate about the care of older adults.
The Division of Geriatrics is important because the population is rapidly aging. 10,000 Americans turn 65 every single day.
Aging is, even more than climate change, the dominant thing that's going to shape the 21st century.
We don't have enough physicians or healthcare providers who know how to take care of seniors and older adults.
Geriatricians are often the people who best understand the complexities of the health system.
I actually think of geriatrics as the heart and soul of medicine.
So most physicians are used to working in a particular environment, in the operating room, in the hospital, in the clinic. Geriatricians cross all of those boundaries.
The Division of Geriatrics is about improving the health and well-being of older people. So we have 3 main pillars of the division. So that's research, teaching, and clinical care. They all inform each other. So we all talk with each other, we all learn from each other, and I think we enhance those 3 pillars by having such tight interconnectedness.
Louise has really brought out this concept that everybody in this division is a leader, and we're all responsible for developing something. Everybody reports to everybody, and everybody works with everybody. We all work together to accomplish our mission. The goal of my research is to understand how older people function, what kinds of things lead to loss of functioning, and how we can help older people who are facing loss of functioning. So I'm interested in the question of why is it that an older person loses their ability to do basic activities of daily living? What are the factors that cause that? And why is it that it happens so often after an older person goes to the hospital? So what kinds of things can we do to prevent that? Our research recognizes the individuality of older people and how we individualize decision-making in older people so that we don't do a one-size-fits-all for older people. I don't think I could be a good researcher if I were not around clinicians and educators. They help me make sure that what I'm doing is relevant.
The educational programs have been very effective for people who come to learn geriatrics.
To place education at the forefront, that is what has really raised our division to the national stage.
Education has a huge role in what the division is aiming to do, which is produce the next generation of geriatricians and healthcare providers who care for seniors and older adults.
And then lastly, clinical. We know that we cannot be a top division without having a coexisting top clinical program.
So often in medicine, we see people in our space. In the hospital, we're often focusing on the diseases that affect older people, but we don't see them in the context of their lives.
I love house calls because my passion in becoming a physician was really taking care of the most vulnerable and underserved older adults. And our homebound population is incredibly underserved because many of the patients we see have not had medical care for years. And so it's an opportunity to reach those that are most vulnerable. And what we know from our own program here at UCSF and from national statistics, we know that caring people in the home can actually help people's health and reduce costs.
What I enjoy about house calls is very beneficial to seniors because, like me, I cannot get out of bed unless someone help me out. House calls let me live independently.
happy 20th anniversary. It has been an amazing 20 years, and we have a spectacular 20 years ahead of us.